Hi, my name is Casey and I'm a registered dietitian with URS Medical, and today I'm going to show you how to use the EnteraLite Infinity feeding pump. The feeding pump is used to feed a patient either through their nose or their stomach. To get started using the pump, you're going to need your feeding pump, an IV pole, and your formula. Always remember to wash your hands before handling your tubing and feeding supplies. First, to get started, you're going to get your formula or your breast milk and pour it into your feeding bag. The next thing you're going to do is hang your feeding bag next to your feeding pump on the right side of the feeding pump, higher than the feeding pump. And load your feeding set onto the feeding pump by opening the door and wrapping the rubber part around the wheel and stretching the cassette to fit down into the feeding pump. Close the lid until you hear it snap. The next thing we need to do is prime our feeding pump. This just removes all the air from the tubing and puts the formula or milk all the way to the end of the tubing so the air in the tubing doesn't go into our patient's stomach and make them uncomfortable. To begin, first remove the cover at the end of the feeding tube. To prime your pump, first turn it on by holding the on-off button for 1.5 seconds. With the end of the tube in a cup, press the prime button and hold the button down until all the formula gets to the end of the tubing and starts to drip out. The next step is to program our pump to make sure we have the prescribed feeding regimen set in our feeding pump. The first step is to turn your on and off button on by holding it down for 1.5 seconds. The pump will always open on the rate screen. This is how fast we are feeding a patient. There are two settings that we will program, the rate and the dose. The rate is how fast we're feeding and the dose is how much we're feeding. When on the rate screen, use the plus or minus buttons to adjust the settings to the prescribed rate. To get to the dose screen, press the rate/dose button one time, and you see dose at the bottom. Use the plus or minus buttons to get to the prescribed dose. You can also program an infinite dose. This setting will run the pump until all the fluid in the bag is delivered. This setting can be helpful if on a continuous feeding or if a patient is drinking some by mouth and then what is not consumed is going into the bag. Then a different dose does not have to be programmed each time since that amount may vary. To get to the infinite dose setting, just press the plus button all the way up till it says INF. Now, the feeding will be over when the feeding bag is empty. There are only two settings to program, and they will remain the same when the pump is turned on and off. The volume total button above the rate dose screen shows the total amount of volume being delivered and the amount of volume being delivered with each feeding. When you press the button once, it shows the amount delivered with each feeding. If you press the volume total button again, it'll display the total amount delivered. This number will keep accumulating and you'll have to press clear to get it back to 0. The button above the volume total button is the feed interval button, and this is rarely used at home with our patients. This setting helps if a patient is being fed at different intervals to start automatically. For the majority of our patients at home, the pump is not connected to them in between feeds, so this setting is not used. Now that we've programmed our pump and have it primed, we're ready to start our feeding. To start our feeding, take the end of your feeding tube and attach it to your patient's feeding tube or extension set. Make sure it is secure. On your pump, press the run button. And now your feeding has begun, and it will stop when the prescribed dose has been delivered. A few things to note. If you look on the back of your feeding pump, there's a simplified list of the programming we just did. Your feeding pump will take about 6 hours to fully charge. You can see the bars charging right here in the bottom corner. When fully charged, it'll last about 24 hours. This is if the feeding rate is at 125 mLs per hour. The battery will run out faster if your rate is higher, or it'll last longer if your rate is lower. We do recommend keeping your pump plugged in when at home, just in case of emergencies. Make sure to keep your feeding pump clean to keep it running at its best. You can do this by wiping it down with a warm, soapy cloth and making sure it's dried completely. Make sure to change your feeding bag out every 24 hours. In conclusion, that's how you use the EnteraLite Infinity feeding pump. If you have any specific questions, please reach out to your local representative or dietitian for further support. Thank you for your time.